İyi akşamlar. Şimdi ruhsal iyileştirim neden gereklidir?
So why do we need mental recovery? In fact, mental recovery is needed in patients in addition to the pharmaceutical, drug treatment, because we are talking about the triple or 4 or 5 drug use, and the clinical researches are also showing that we need to use monotherapy, but in clinical practice we have to still use them, and we do not have any more elements in our armament. So why do we need mental cure? We know that mental and affective, schizoaffective, schizophrenia and schizophrenic and schizoaffective disorders, bipolar disorder, the alcohol and substance addiction, these are very frequently seen. Borderline personality disorders. We can think about these different aspects, and all these permanent mental disorders should be talked about. So we are talking about mental rehabilitation, and we also use the word habitation. When do we use habitation? For instance, if there is mental retardation, we use the rehabilitation. In fact, in mentally retarded people, the dementia, autism, and attention deficit hyperactivity disorders, we use habitation. That is, we are trying to have the adaptation to the normal life. However, when we are talking about rehabilitation, we are talking about those who are already having the capabilities but who lost them because of the disease. First, we need to start at young ages. In terms of cure, in terms of recovery, we do not have a total cure, and the patient, family, and community is affected. And there are depressive periods, and there is a very high cost in these diseases. When we look at the general situation, in schizophrenic patients we have the just 1/3 of the patients where we have the normal functionality. Of course, maybe we can suppress the symptoms, but we are not very successful in increasing functionality. When we look at the basic problems, in the basic case of schizophrenia, the accommodation and family support is a very important problem. Body physical problems are very important. 1/4 of the patients are overweight. Metabolic syndromes are seen very frequently. They have very frequent depressions, and they also resort to violence. And also they are most of the time single, and they are having difficulties in finding a spouse. Unemployment and lack of functionality is another problem. The burden on the family is an important thing. We should just think about ourselves. If there is a schizophrenic patient, a mentally sick patient, of course I'm not talking about the recovered ones, but living with a person who is a drug addict or schizophrenic, it's very difficult to live with such a person. I would not like to have such a family member in my family, but of course if there is one, of course I will cope with that. But as the state, we need to relieve the burden on from the families. And also in many of the families, most of the families think very deeply that I wish he would die and we would get rid of him. They would never say it aloud, but that's what they think. The treatment problems are very important. Stigmatization and the social isolation are very important. So in the schizophrenia case, that is, if the person has gone crazy, then the drug therapy, pharmaceutical therapy on its own will not be effective.
Hastalıkların tedavilerinde ilk dönem tedaviye başvurdukları zaman
When they resort to treatment in the first phase, there is a higher chance of recovery. However, if it is progress, then there is less chance of recovery. And in the long term, only 1/3 or 1/4 of the patients are recovered. We have the lack of ability or disability in these patients, and they need to be taken back into the society, and of course the rehabilitation should be provided in these patients. And in our basic education, for instance, we are talking, there is a department called physical therapy and rehabilitation. We received that education during our training in Faculty of Medicine, and also in neurology, orthopedics, those who are disabled, who have lost their capabilities, some rehabilitative activities and physical treatment activities are or practices are done in order to recover the physical capability loss. However, in the mental disorders, we do not have the mental disability treatment, and there is no education specifically for that. In schizophrenia, what is cure? In fact, we would like to have the remission in the symptoms of the disease, and we would like to have the person to live inside the society in an independent way. They may be independent, but they are not inside the society. We are opening community health centers or special rehabilitation centers, or there are some associations, and people are going to those centers. But it does not mean that if a person is going to those centers, he recovers, because they should be able to live in the society on their own, and they should have their own meaningful targets and hopes. And if they cannot hope for the future, then we cannot say that that person is cured or recovered. So we are not only talking about the suppression of the symptoms, but we are talking about a meaningful life for the person and having functionality in social life. Therefore, we need to increase the social functionality and quality of life of that person, and that person should understand how to manage his disease, and the effects, the causes of the disease should be eliminated. What is the main aspect of rehabilitation? The disease management is very important, because if we cannot teach the patients or the family members about disease management, then we cannot reach anywhere. At the same time, the health should be improved. For instance, that person may have the mental disorders, he may have gone crazy, and the recovery is not at the desired level. Therefore, the healthy aspects of this person should be improved, and it should be a part of the rehabilitation. It is something that can be done very easily, because the interpersonal relations should be improved for that person. And it is something that can be taught to the person, to the patient, and they do not have a learning difficulty. They can learn very easily. What are the basic components of rehabilitation? There are 7 basic components, 7 basic elements. If we learn them well, and if we underline them well, then we can achieve rehabilitation. First, we have the auto-management of the disease. The patients should understand how to manage their disease, and they should be able to make their own treatment. For instance, the mental disabilities should be taken at hand. Together with the family or in a group, you can deliver a mental training, and they need to acquire some abilities for the self-management of the disease. And then they should be trained for skills. These people are not going to just use drugs. They are going to go on visits. They are going going to go to do some sports, they will buy some things from the grocery store, etc. So we need to provide some trainings for developing their skills, and if they are living on their own, then they should be able to clean the house, do the cooking, and so all the life skills should be improved, and we should train them about these skills. So we ensure the mental training and self-management and skill development. Again, this is not enough because most of the patients live together with their families. Maybe we can spend half an hour or 1 hour with that patient, but the family members are together with them for 24 hours a day. Therefore, the families should be the basic tool for the training, for the treatment of that person. So the family members should be trained. They should be trained on the mental development and mental rehabilitation. But also we need to have some hobbies and employment of that person. We have just seen an example of that. For instance, the patients at Bakırköy mental hospital, patients made some artworks and some paintings. So it is very important that they are involved in certain kinds of activities so that they can feel themselves useful. But of course, it should not be just a hobby. These people should be in the working places, in the business environments. They can work in protected areas, and also they can be employed in the disabled disabled positions. But it is not enough to have them employed, but also there should be some protective environment for the patients. In many of the studies, they are employed, but just within 1 year, they just quit the job. This is a mental disease. It's already challenging. It's already difficult. Therefore, once they are employed, they should be supported. So the community health centers can provide the employment for that person, but if you do not support that, we can say that all those efforts can be in vain. In addition to that, we need some societal support, because patients are connected to some institutions. For instance, when you are collaborating with them, like in a rehabilitation center or a community health center, if you have 50 or 100 patients, in time, these patients are regarding those centers as a second home to them, and they do not want to leave those centers. We do not want them to be addicted to those centers. We want them to be involved in the society, integrated in the society. Therefore, we need to support the families and patients, and we need to support the establishment of some clubhouses or some associations, some accommodations for those who do not have that. And also they should be in a position to defend their rights, because most of the time patients and the family members are unable to defend their rights. So they should be also supported in that sense. Again, case management. Some of the patients are living alone, or they are deprived of the family support, or family members cannot provide the enough support, adequate level of support to the patients, because they are also very inadequate. In those cases, we should not just ignore these patients. With case management method, the patients should be taken one by one, and there should be a team of 15 people who will be involved with these patients on a 7-24 basis. It is still not enough. When the patients are in a cafe, when they are strolling around in a park or in a garden, or going to swimming, etc., they can still have a crisis. So we need to have the assertive communicative treatment, ACT. Whenever they need the treatment, that treatment should be brought to them. And again, this is a system that should work on a 7-24 basis. All of them are in the rehabilitation studies, and clinical evidence and benefits are set forth already in the researches. Therefore, we are talking about the depression, hospitalizations, in the patients. If you do not provide the rehabilitation at home in place, then the treatment will be lacking. The family should support the patients, and then only then we can achieve the recovery. And also the quality of life should be increased in the patient. And all these practices should be followed. This is very briefly is the system that is tried to be established in Turkey. If the person goes to a hospital, and if they go to a community mental health center, then they can deal with some hobbies, employment, and also some trainings and rehabilitative treatments should be provided, and societal resources should be involved in this process. And whenever there is an emergency need, in emergency situations, their needs should be satisfied, and also the accommodation centers should be provided so that hospitalizations can be reduced. Thank you very much. This is the end of my presentation.